Hello, everyone, and welcome to the fourth session of the Center for Healthcare Innovations 2020-2021 Patient Engagement Lunchtime Learning Series. This session is on practical engagement, focus, and discussion groups. Today's session will be presented by Ogai Sherzoi, a knowledge broker in patient engagement here at CHI with experience in community engagement, research, and facilitating group discussions. We also have joining us Alexie Touchette, a research coordinator and former master's student in the Department of Community Health Sciences at the University of Manitoba, who will share a case study example using online focus groups. We do have closed captioning available that can be turned on using the subtitles button at the bottom of your screen. You can pose questions or comments in the chat box at any time. We'll have a Q&A session at the end, but all participants will be muted to avoid interruptions and echoes. And I'll go ahead and turn it over to Ogai.
Thanks so much, Trish, for the lovely introduction. I would like to start off by acknowledging that we are gathered here today on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. In coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. In talking about patient and public engagement in health research, it is in fact Indigenous research methodologies that are at the forefront and Indigenous scholars, researchers, and communities that we should be looking to. Also, thank you all for joining us today. The 1 hour that we do have with one another, I want to make sure it's as interactive as possible. So we will have some poll questions, but also I encourage you all to use the chat box throughout the session to share your knowledge and experiences, but also any tools and resources that you might have come across that you think would be helpful for folks that are joining us today. So please don't hesitate to ask questions. And again, you can use the chat box, and also we have time allocated, as Trish had said at the beginning, at the end of the session. So in terms of disclosing any conflicts of interest, I work at the George Fay Yee Centre for Healthcare Innovation and no other conflicts to disclose. And Alexie also has no conflicts of interest. So the objective of today's session is to describe the difference between focus groups and discussion groups, determine when each approach is appropriate to use, and assess challenges and needs for planning effective focus groups and discussion groups. So we're going to start off with a poll question. The first question being, have you ever moderated a focus group? And the second question, have you been a participant in a focus group? So I'll give you all a few seconds. Okay, so can we share the results to the first one?
Can you see it?
Yes.
Okay.
So can everyone, Carolyn, can you see the results on yours? Okay, so this is quite interesting, actually. We have exact 50-50. So for those who have moderated a focus group, this is excellent. It's going to be a refresher for you, but also you can definitely bring in your expertise also and post some of your knowledge in the chat box and your experiences. And for those who've never moderated a focus group, this is going to be quite engaging, and we're going to share with you some basics around focus groups that will be helpful to you in the future when you moderate your focus group. And we will go to the next question. Have you been a participant in a focus group? So we'll give you all another 20 seconds. Okay, so again, the results are quite interesting because I didn't think we were going to get anyone who participated as a participant in a focus group. So 45% of you have. So that's quite interesting. Being a participant in a focus group is so much different than being a moderator. So again, you can share some of your experiential knowledge of what it's like to be a participant. And again, being on the other side makes you a better moderator because you know what to expect and what to change things in a focus group to make it more valuable for individuals who are participating in your focus groups. So thank you all for doing the polls with us, and there's a few more coming up soon. So looking closely at focus groups, so as humans, we are social beings. We have a long-standing history of gathering together to discuss important issues, and this can be seen across cultures. So researchers have utilized this naturally occurring behavior and refined it to make it a method of research. So focus groups is a qualitative method which began to be used both in academics and applied settings, but really took off in marketing research and has recently been adopted in numerous fields. So interest in the use of focus groups has continuously grown across diversity of contexts, including health research and community settings, to explore a wide range of issues. So we'll go to the next slide. So focus groups are a participatory method of collecting data in qualitative research. A focus group is basically a group of individuals who are brought together for the purpose of collecting data. It is, however, important to distinguish between group interviews and focus groups. Group interviews involve interviewing a number of people at the same time, with the emphasis on questions and responses between participants and researchers. Focus group, however, rely on the interactions within the group based on topic provided by the researcher. So this format allows discussion of the interview questions and can bring out aspects of a topic that a researcher may not have anticipated and that may not have emerged on a one-on-one interview. So looking closely at different types of focus groups, there is single focus group, which is the classical type of focus group, which is seen mostly in health research. And really my discussion today, when I'm speaking about focus groups, will be focused on this type of focus group. And then we have the two-way focus group. So this is basically each focus group alternatively watches other group and discusses their observations, and oftentimes through a two-way mirror. Dueling moderator focus groups. So basically it's two moderators taking opposite positions. So for example, two moderators are present, one which ensures the group session progresses smoothly and one that makes sure that the topic in question are covered. So dual moderator focus groups typically result in a more productive session. And then you have the respondent focus group. One or more of the participants in the group takes the lead as a moderator. This is done to change the dynamics of the group and generate more varied responses. In contrast to other types of focus groups, a mini focus group has only 3 to 5 participants. So a smaller group of people creates a more intimate environment for discussions and is particularly appropriate for sensitive issues and topics. And then we have the online focus group, which is a great way to bring individuals together who may live in rural or remote communities, or they might be across different provinces, or have health complications, which makes it difficult to meet in person. And then also considering today's context where we're unable to meet in person, online focus groups have gained a lot of momentum. So this is where Alexie is going to provide you with real life case example of how to use online focus groups, and will share some of her knowledge and expertise. And so it is suggested to have anywhere from 5 to 10 or 6 to 12 participants, and the number of participants will depend on the purpose and nature of the study. So a group of 6 to 12, for example, is large enough to offer a variety of ideas and experiences, but also allows enough time for each participant to contribute in a meaningful way. So moderation of a large group can be challenging in texting for participants. So again, smaller groups are more appropriate when the topic area is controversial and or emotionally charged. And larger groups are more appropriate to utilize when researchers want to hear numerous brief suggestions from participants. And focus groups usually last between 1 to 2 hours, during which participants are asked 3 to 5 questions. Again, because of the context of today and doing online focus groups, it's really important to be cognizant of some of the challenges of spending time online, especially sharing. So the amount of time spent should really be in consideration of talking to your participants to make sure that you're not spending 2 hours when it's very taxing for them. So maybe you'll have to change that to an hour, but more frequent focus groups. And then focus groups can be useful for developing or introducing a new program or service, getting answers to specific research questions that you otherwise could not obtain from written surveys, and obtaining in-depth and diverse perspectives, opinions, and thoughts of patients, caregivers, and communities. So we have another poll question. Have you facilitated a discussion group? Okay, so we'll give you another 20 seconds or so. Okay, well, it looks like majority of you have done facilitated discussion groups. So that's quite interesting, and that's awesome to hear that you've been involved in patient and public engagement. So again, this is going to be a refresher for you. And for those who never have, this is going to be a great introductory session for you in terms of what it means to facilitate a discussion group. So before we begin our talk around discussion groups, it is important to first understand what patient-public engagement in health research means in the realm of patient-oriented research. Patient and public engagement, to put simply, is about authentically engaging diverse people, informal caregivers, and communities with experiential knowledge of health alongside social conditions to have a say in decision-making about the entire research process. So in other words, it means that patients and members of the public move beyond the role of a research participant or subject and take a position on the study team as a partner or co-investigator, where they help to identify research priorities that matter most to people living with the health condition being researched, and or help shape and clarify research questions so they reflect the needs, concerns, strengths of patients and informal caregivers and communities. So for example, engaging folks help optimize the research questions that will reflect community context and ensuring research questions are culturally appropriate. So engaging folks as partners also help to ensure the methods proposed for the study are appropriate, acceptable, accessible, and sensitive to the very real-life context in which patients and informal caregivers and communities live, work, and play. So patient and public engagement also helps to ensure that research uses outcomes that have true meaning to the lives of patients, informal caregivers, and communities. And lastly, having patient partner as part of your research team helps to ensure that the language and content of the information provided to participants in studies are appropriate and accessible. So for example, it's important when you are sending out questionnaires to participants that it's co-developed with patient partners to make sure that it's accessible, the language is appropriate, and some of the questions are culturally safe. And so discussion groups are used as part of patient engagement activity. Discussion groups are basically small groups consisting of 5 to 10 individuals who are representative of the population's experiential knowledge is sought. So individuals in the group focus on one research decisions, whether it is a research priority, question, research design, data collection, participatory approaches to be used, outcome measures, interpreting, or dissemination of research findings. So patient and public partners are also encouraged to be actively involved as co-facilitators. allowing the patient partners to steer the research and partake in data collection. This approach shifts the power to more genuine collaboration. And then discussion groups are useful for identifying public opinion and encouraging open public debate around certain research decisions. So for example, what should be the research priority? What should be the research questions? How should we collect the data? What outcome measures should we be looking at? What does the data mean to you? How should we share the research findings so it reaches the communities that we want the information to be shared with? So discussion groups also provide opportunities for engagement of voices traditionally less heard in health research and oftentimes silenced due to the barriers faced within our societies. And discussion groups provide insightful information for the evaluation of the research project. And lastly, within the discussion groups, you can use previously analyzed data to generate alternate interpretations. And oftentimes, focus groups and discussion groups are used interchangeably. And however, there are differences in the intent and purpose of conducting focus groups and or discussion groups. So this can come and cause some confusion for individuals in terms of differentiating research participants versus patient-public partners in health research. So in 2018, Daria and colleagues published an excellent article describing the differences between focus groups and discussion groups in order to create clarification between the two and when it's appropriate to use. I have included the link to the article in the resource list, which will be shared with all of you who have registered via email. So you all get a list of links and resources to access. So again, just to reiterate, focus groups are used with research participants to provide input and answer research questions, whereas discussion groups are used with individuals in order to receive input around research decisions. So for example, helping the researcher formulate and co-develop the research questions. And in other words, members of the focus groups are participants, where the discussions groups members are research partners or co-researchers. So it is common in focus groups to record the session using audio or video and transcribing and using qualitative data analysis. Because focus groups are part of qualitative research used to collect data, you will need ethics approval ahead of time and follow ethical procedures, ensuring informed consent have been approved and participants have provided their permission for the focus groups to be recorded. On the contrary, a discussion group members' feedback is collected for research design and decision-making purposes and not part of data collection. Therefore, you may not need to go through the ethics board unless you are using the information as part of your research data collection. However, it's always good practice to consult with ethics board if you are unsure and need guidance. Also, it is important to conduct your engagement activities in an ethical manner with considerations around trauma-informed and anti-oppressive practices, so we avoid causing undue harm to patients and public partners. Again, you might find Doria and colleagues' article helpful as it includes a great flowchart for determining which approach to use and whether ethics approval should be sought. So here is an adaptive version that Trish wonderfully developed and put together with permission from Daria. Again, this is a great tool to have in determining which approach to use, whether ethics approval should be sought. Again, you can find this in the PowerPoint, which we'll share it with, but also we'll have it as part of the resource as well. So now we're gonna I've been talking for quite a bit, so we're gonna turn it to you and we have a little quiz for you to see how much it makes sense, all this information. So you're gonna pick one statement that is false amongst the 4 options. So focus groups are a participatory method of collecting data in qualitative research. Discussion groups are useful for getting answers to specific research questions. Focus groups should have between 6 to 12 participants, and discussion groups should have between 5 to 10 partners. So choose one that is false. Okay. Well, look at that. That's excellent. So majority have chosen that discussion groups are useful for getting answers to specific research question is inaccurate. You're right. Um, Discussion groups are actually about designing the research question. So that would be more a focus group. And then when it comes to discussion groups should have been between 5 to 10 partners, that is actually accurate. So yeah, but thanks all for participating. And it's looking like a lot of you have quite a bit of knowledge around this. Okay, so I'm gonna quickly share some advantages of both focus groups and discussion groups. So conducting focus groups and discussion groups are cost effective. Each participant or partner gets the opportunity to reflect and react to the viewpoints of other group members with which they may agree or disagree and not have been aware of such. And discussions in a group setting are oftentimes dynamic and stimulates further in-depth conversations. So when individuals listen to other stories, it could trigger memories of their own experiences on a specific research topic. And all members, including the facilitator or moderator, gets a chance to ask follow-up questions, which can lead to producing more information. And group members can build on the answers of others. And as a facilitator or moderator, you have the opportunity to ask for clarification, but also you can seek diverse opinions and offers flexibility for probing questions. And looking at some limitations, so some individuals may not feel comfortable sharing their stories and experiences in a group setting. It can be taxing for members if the group is too large. You do need a skilled moderator or facilitator to ensure all voices are heard and group is not monopolized by a few members. So they need to have techniques and skills to draw out opinions and perspectives. And for members who are introverts, so members who are more reserved or shy, in a group, they might feel the pressure to agree with more vocal members of the group rather than expressing their own true opinion. So in that case, again, as a moderator or facilitator, it is our job to observe and look and follow up to make sure that we have obtained everyone's perspectives and voices. And moving forward to implementation, so whether you are moderating a focus group or facilitating a discussion group, it is important to ensure that you are choosing a space that is accessible, inclusive, safe, emotionally, culturally, physically, and spiritually to all members. So the best suggestion that I have for you is to ask. Simply ask the individuals you're engaging, where would they like to meet? Instead of guessing and choosing a space that could potentially harm folks. And if you are engaging individuals online, we always suggest doing a pre-assessment of needs to ensure people have a safe, confidential space in their home to voice their experiences, but also making sure they have access to internet and computer. I've also included a link to one of our blogs that goes in depth around pre-assessment of needs, and there are questions that you can use or modify when doing your assessment. And then lastly, as a facilitator or moderator, you will be responsible to create the agenda for the group, and always good to send ahead of time so that people know what to expect before coming into the group. And when structuring your group, it's important to create a welcoming environment. If in person, having supplies for name tags so folks can get to know one another, but also good to highlight housekeeping items. For example, where the bathrooms are. I know it's simple, but it makes people feel safe and comfortable knowing where the bathrooms are located. And in today's current context, it would be good to have principles of working together online ahead of time. So I know Carolyn had created a list, which I'll quickly and briefly go through it. So for example, you can have this on the chat. So when folks come in, you say, please identify yourself when you log in so you know your audio works. Please keep your audio muted until you're ready to speak. Raise your hand either on the video or in the chat section. And also there's like a little reaction button now that you can have the hand raised when wishing to speak and wait for the acknowledgement from the moderator or the host. And then keeping the comments and questions brief, but you can post that in the chat box. And then keeping the topic under discussion, respect confidentiality where appropriate, share airtime, so equal voices for all members, listen closely, and it's always important to highlight that people do have the right to pass. No one's forced to share if they don't feel comfortable. And trust in relationship is key when it comes to group cohesion. So icebreakers are very purposeful as it creates the foundation for relationship building through listening and sharing. So therefore creating a level of safety for the whole group where individuals feel comfortable sharing their thoughts and discussions around more difficult topic areas. And also important to mention that discussions around confidentiality with the group members who are either gathered in a group setting or online, in person, it doesn't matter, to really talk about when conducting the focus or discussion group, everyone knows, including the facilitator or the moderator, who the stories and information and perspectives belong to. So as a result, there cannot be any anonymity and full confidentiality cannot be guaranteed, and members need to be aware of such. So as a ground rule for participation or engagement, it's important that all members keep other group members' information private. The only time the confidentiality will not apply is when there's a disclosure of abuse, unforeseeable and imminent harm to them or others. So it is our duty as a facilitator or moderator that if someone discloses such information, that A, we have the number to crisis mobilize so that we can contact them right away if there's safety concerns, child and family services, and or the police to make sure that safety of others are in consideration. And again, that is our duty to do that and follow up. And lastly, discussing the goals and objectives of the group so everyone knows what to expect and can be on the same page. And so moving on, if you have content to share with the group, again, always good to send it ahead of time. It's good practice to send it out 2 weeks in advance so folks have the time to review and process information and be able to engage fully. And focus groups utilizes open-ended questions focusing on research topic. And again, on the other hand, discussion groups utilizes open-ended questions around research process. So it's good to do a debrief summary at the end to make sure you have captured the perspectives of the group members accurately, and then can wrap up the group by including next steps and closing activities. So always good to really highlight the loop. We always say close that loop of engagement, and they need to know how their information is going to be used, in what way, and if you cannot use their input, still letting them know and the rationale behind as to why. So it's important to think outside the box and be creative in the ways you're asking questions to promote fruitful discussions. So in the next few slides, I have a few examples that you might find useful. Questions can be created in a form of exercise or activity, so listing, choosing, ranking, and prioritizing. So being creative with how we ask questions is important as it can engage folks in different ways and elicit answers to promote discussions. So when asking questions, we have to keep in mind the age group. Are the participants or partners children, youth, adults? Do they have language barriers? Are there cultural differences? And then also keeping a close attention to the topic area. So for example, children act out and express feelings and ideas, or topic areas that are sensitive using activity-oriented questions can make it less threatening. Activity-oriented questions can be used at any stage of a focus group or discussion group, for example, during a warm-up, transition to another area, or summarizing what was discussed. So looking closer at the free listing, that's where participants in a focus group are asked to make a list in order to answer the research question. In discussion groups, partners are asked to make a list focused on the research process. So for example, focus groups, you can look at a list of solutions to problems, ways to manage pain, issues that need interventions. And then looking at an example for discussion groups, it can be a list of research questions, list of research topic areas or priorities that are important to individuals, families, communities. And then we have the rating questions. So rating questions really help in terms of priority setting. So participants and their partners are asked to rank a list of terms according to specified dimensions. So for example, most likely to least likely, most accessibility to least accessibility, and so on. So this activity helps to prioritize needs, ideas, and factors. And then we have pile sorting. So group members put together items that have similarities and differences from others. So typically done with cards or paper, can also be done with objects or photographs. So facilitators and moderators can start discussion by asking what items grouped together have in common. This activity helps start conversations, thought process around the topic area, and elicit group discussion around emerging themes. And then looking closely at choosing among alternatives. So this is a popular technique that is used with different age groups. So the facilitator or the moderator offers the group various alternatives, and partners or participants discuss advantages and disadvantages and select 1, 2, 3, and so on that is most appropriate. So having group members choose gives the power to partners or participants as they choose topic areas, and it's not predetermined by the researcher. And my most favorite is storytelling. So partners and participants are invited to share their story. Partners can tell their narrative around topic of interest, patients can tell their narrative, and then partners can share their experiential knowledge and ways to inform research design. So creating space for folks to share their stories can be quite powerful. And also storytelling can be useful when thinking of solutions, bringing diverse perspectives together. And then storytelling is a method that has a long-standing history and well-received among diverse groups. For example, Indigenous peoples, immigrants, refugees, and our newcomers from diverse countries and cultures and backgrounds use to share and pass knowledge through stories. And as a facilitator or moderator, it is always important to be mindful and prepared to deal with strong emotions that might arise in a group setting. So we were asking individuals questions pertaining to their lives and experiences. There's a chance that it might elicit or release strong feelings and emotions, especially in today's current context with the large societal changes as a result of the pandemic, but also the ongoing racism, colonialism, and the unrest around the world. So Carolyn Shimon, who is our patient engagement lead here at the Center for Healthcare Innovation, has done a wonderful job of creating foundational materials around trauma-informed practices. I have also included a link to her blog series in the resource list that you will all get. And just a note, as a facilitator, we cannot take the role of a counselor or a friend. We have to guide individuals to seek supports outside of the research group. Regardless of the emotions expressed, as a facilitator, your relationship will continue to be a partnership based on mutual respect and trust. So when emotions do arise, what you can do is allow space for individuals feeling strong emotions to regain composure by sitting quietly and waiting and just allowing space. And important to be empathetic by stating something like, "It's been very hard on you. Are you okay to continue?" And if individuals no longer want to participate, we can ask if they would like to call their supports, and we can facilitate that. And also important to give participants or partners counseling resources ahead of time in case they need supports. And I've also included the counseling resources in your resource list. Again, it's very much Manitoba context-based. So for folks who are from other provinces, it's always a good idea to pull together some resources that are open and relevant to your local context that you can share with your partners or participants. And some emotions that you might observe as a facilitator or moderator is that individuals might be disengaged. So you can do an energizer activity, ask members to do more of the sharing. If you notice that folks are looking tired or fatigued, maybe it's time to take a break or do an energizer. Maybe turn the conversation to more lighter topics, or stretching. That's an excellent activity. Get everyone to stand up, do a stretching, and that gets the blood floating, and individuals gets a little break. And if you see a member on the phone or distracted, it's important not to assume and be open-minded when interpreting behaviors. If the member is directing to others and limits group members' participation, that's when it's important to have the topic around the group rules or guiding principles. And just a few tips before I turn it over. It's always a good idea to create a checklist of all the items that you will need to moderate or facilitate your groups. What is not said is maybe just as important as what is said. So observing for nonverbal cues and making sure to stick to the timeline that was given to participants or partners. So individuals may have other commitments and may feel uncomfortable to be the first to leave and obligated to stay longer to avoid being seen as just disruptive or rude. And being mindful that we are inclusive and welcoming with members from diverse backgrounds and experiences. And important to record what participants say word for word. If summarizing, check back with the group to make sure you have captured what they intended to say. And using name tags allows you to call participants or partners by their names, which helps them feel recognized and more comfortable. And ensuring that everyone gets a chance to share their voices and not just one member dominating the discussion. So not to over direct the focus group, as we want to be mindful that we're not bringing our own views into play. So in discussion groups, same thing, sharing power with partners, but allowing space for them to direct the focus of the group and not influencing their perspectives. So now I'm going to turn it to Alexie, who I'm so excited. She's going to talk about online and her real life case example and experiences. And this couldn't be more timely than today. So Alexie.
Right. Well, hi, everyone. As Ogai mentioned, I'll present a few key points from a study that I was involved in that was led by Dr. Jackie Ripa, who is an associate professor in occupational therapy at the University of Manitoba. This study used an alternative approach to customary in-person focus groups, which is the asynchronous online focus group. Before I go into detail about what this approach is and how we used this method, I want to state that although the study was done before COVID, this method is becoming all the more relevant during COVID times as researchers look for other ways of collecting meaningful data. So first, what are asynchronous online focus groups? These are semi-structured online group discussions in which participants respond to predetermined questions and other participants' comments, and this at any time, so not necessarily only when other people are online and participating. And the aim of this study was to engage Canadians with limited mobility regarding the creation of an online toolkit for individuals who use mobility devices during the winter. And we did this by using an asynchronous online focus group. Very briefly, we conducted 5 separate week-long online focus groups in 5 provinces. So this included one for each of British Columbia, Manitoba, Ontario, Nova Scotia, and Quebec. And for the Quebec focus groups, all the material was translated into French, and the 2 facilitators were French speaking. We recruited individuals through posters and email advertisement in major organizations, so such as MS Society, Cerebral Palsy Association, and Canadian Paraplegic Association, as well as through universities and mobility aid vendors. To be eligible, participants needed to be mobility aid users, 19 years of age or older, able to access the internet, and willing to spend a minimum of 30 minutes daily for the entire week answering questions and responding to other participant comments. So we developed a secure website using wordpress.com, and this was used to create an online discussion board. Each day, we posted one predetermined question on the discussion board relating to the research topic. So in this case, it was winter accessibility. And 3 research assistants facilitated discussions by encouraging further detail, asking follow-up questions, and providing just general support. Of note, the research team included a person with lived experience who, among other things, helped facilitate the discussions. Having a person with lived experience facilitate the discussion was really beneficial because they were able to further validate other participant comments, as well as share their own experiences. At the end of the week, small honorariums were mailed to participants, individual access to the discussion board was canceled, and the site was cleared and prepared for the next group. Overall, we recruited 24 participants from across Canada who participated. In BC, we had 8 participants, Manitoba 6, Ontario we had 5, Nova Scotia 3, and Quebec 2. So now I'll just discuss a few advantages and disadvantages of an asynchronous online focus group. So this method allows for the convenience of participation through flexibility of schedules and availability. Because it was asynchronous sessions, participants as well as the facilitators had the flexibility of responding when it was convenient for them. This was especially good for participants who had full-time jobs, or for myself and the other facilitator who were still in classes at the time. This method is also cost effective. So one reason we chose WordPress was because it was free and secure website, and because we were able to easily download the content of the discussion boards without needing transcription. This method also allows for the inclusion of geographically distributed participants. So it allowed us to have people from 5 different provinces participate. This method also allows time and space for reflection. The asynchronous online format gives people more time to process, reflect, and respond to others. This might be particularly helpful for sensitive topics that require time for thoughtful responses and to process emotions. It also allows people with complex communication needs the time they need to compose messages and comments. This method also allows for the inclusion of more voices. So this provided the opportunity for individuals who might otherwise experience difficulty attending in-person focus groups or interviews to still contribute their perspectives and receive advice and support from people with shared experiences. This method also encourages peer problem solving. So the asynchronous online format permits conversations to occur between participants that don't necessarily disrupt the overall flow of topics. So very often we would actually see someone sharing a specific issue and other members would comment back suggesting their strategies and just offering general comfort and support. And online discussions are also perceived as having increased anonymity. And because of this, participants may speak more openly and candidly about their perspectives and experiences. However, there are certain limitations of this method that are worth considering before you pick. So there is a lack of face-to-face interaction. Participants can neither hear nor see each other, so there are no verbal or physical cues such as body language, facial expressions, and tone of voice. This can be particularly difficult with a sensitive topic, so it's important for the facilitators to be aware of this and to compensate with frequent and sensitive input. So for example, we made sure that we would acknowledge every comment made by participants and try to validate them, whether that was just by liking their comment or by commenting back anything like, "Thanks for this comment," or "What such a great comment." It's also important to consider accessibility and inclusivity. So for the purpose of this study, an online focus group was a way of reaching individuals who might otherwise not be able to attend in-person focus groups. However, by choosing this method, we may have inadvertently excluded individuals who don't have internet connection or a computer or a device to use. And last, where there is technology, there's also technology problems. So it's also very important to consider that participants won't all have the same level of technological knowledge. To compensate for this, or at least in part, we provided detailed step-by-step instructions to gain access to the discussion board, and we provided my phone number and email address for anyone who was having difficulty with technology use and troubleshooting. So overall, the takeaway message would be like any data collection method, the method selected must match the research objectives and the population. And the asynchronous online focus group method provides just another option for research teams. And now I think we're open for questions, if anyone has any.
Yes, so if anyone wants to know more about Alexie's project that she was working on, discussion groups, I don't see anything in the chat box, but I'm wondering if I could pose a question. What would be the difference between, you mentioned facilitators and moderators, what's the difference between those two?
Trish, that's an excellent question. So a facilitator is someone who helps a group of people understand their common objective, and assist them to plan and achieve those goals without taking a particular position. So in other words, staying very much neutral. So while a facilitator assumes a position of responsibility that influences group outcome and process, they should not attempt to be a content expert. Whereas a moderator is a person who presides over the meeting or discussions. They take more control, and they monitor the exchange between participants and move the discussion from one topic to the next. And that's why we often say moderator with focus groups, because they do come with questions and they do have specific things that they need to get out. Whereas with discussion groups, you have a facilitator that very much is sharing the power and facilitating the process without influencing to really get the perspectives of the group.
I think we have some questions in the chat box. First of all, are participants reimbursed for their time to participate in the forums? If so, how is the time estimated? Do they self-report?
So I believe that's the question for the online focus groups. Okay, so we did reimburse the participants. This was a bit tricky because they were from different provinces and we had to go through ethics, and there was a few issues there, but they were reimbursed with small honorariums. And while we were recruiting, we did specify that we would like them to spend at least 30 minutes a day for 7 days. That was the length of the focus groups. So they didn't necessarily self-report how much time they spent on there, but you could see the answers that seemed to take longer compared to the answers that were just short. And we just kind of put our trust in the participants that they would participate and take the necessary time to formulate their opinions and perspectives.
Excellent. Thanks so much, Ogai, or Alexie. Ogai, I think this is a question for you. Can you please include where to get ideas for activities and icebreakers, both online and in person? I think you probably have a lot of recommendations.
So we started, I'll take a look and send it via email. So maybe we'll write down your name, or maybe we can
add it to the resource list if you want.
Sure. Yep. So I started pulling in a ton of different icebreaker activities, but I do want to mention that you have to be very purposeful in what kind of activities you're choosing and why. So for example, I did a photo voice research project. So I chose to have my icebreaker activity be about looking at pictures and what did they see in the pictures. So really connects and gets people to start thinking of your topic areas. But it's exciting. I have created a list. So I'll share that.
Thanks, Ogai. I think we've got another one for Alexie. Did the participants in the online forum get copies of the content afterwards?
So I wasn't part of the data analysis for this study, but I do believe they did get a copy of the content, or at least the main themes. And we did actually ask them, because this was only part of the overall project, we did ask them if they would be willing to participate in follow-up parts of the study. So they did provide, so we did have communication with them afterwards as well.
Excellent. Thanks, Alexie. Oh, they're still rolling in. We got some more going on. Let's see. What scale or schedule have you compiled for determining amounts of honoraria? Do you guys, I know.
Yeah, so for this one, if I remember correctly, again, this was the principal investigator that was in charge of this. I think ethics suggested the amount for the honorarium.
Okay, and I know with Ogai for partnership, a lot of times we use the SPORE recommendations, which are, is it minimum of $25 an hour?
Yeah. Oh, somebody just said that in the chat. Yes.
Oh, look at that.
We're all on the same page.
Yeah. on the same.
So again, partners and participants are quite different. So a partner is sitting on your research team and they should be reimbursed for their expertise because they're formulating a whole research design. And participants, when it comes to ethics, it's not about reimbursement so much because you don't want people to be part of your research because there's a money attached to it. So ethics really, but you do want to say thank you for their time. So a lot of times that amount is much smaller. So Alexie, like what would you say the amount was for your project?
For the project that I was talking about, it was $20, and it was in form of a gift card.
Yes.
Was that per week?
Per participant.
Okay.
Yeah.
Which is still not bad.
Excellent. I think we have another question for Alexie. Did participants in the online forum use real names or usernames? And how did you handle the potential for participants to screenshot the forum and share outside the group?
So when they got access to the online discussion board, they had the option of using their real names or usernames. We often found people using usernames. And similarly to what Ogai was talking about in online or in-person focus groups, that potential for other people to share that information is still there. So that potential was there, but we did ask participants to just be respectful and to not do that. But we did inform everyone participating that it couldn't be anonymous just because of the potential of sharing.
Thanks so much, Alexie. I think we noticed in the chat box too, the use of acronyms, just to let everyone know. So SPORE is the Strategy for Patient-Oriented Research, and it's a national initiative funded by the Canadian Institutes of Health Research. And each province and territory has a support unit, and the Centre for Healthcare Innovation is actually the Manitoba support unit for the Strategy for Patient-Oriented Research.
Good job. Thanks, Carolyn. I'm just looking at the time. Again, as before, I talked about being cognizant of time. And I know that many of you probably are going to get ready to start your day or meetings. So if there's no other questions, or maybe we could answer one more if there are.
I think people are just sharing info in the chat, which is
Are they? Thank you. Yes, this is a great space to share information amongst each other. Thank you all so much for your gift of time and coming here and posing such wonderful, insightful questions and sharing resources with each other, because the only way we can improve any sort of engagement is to really support each other and become a community of practice and an ally to one another. So I'll turn it to Trish. Thank you so much, everyone.
And as I always do, before everyone goes, I would like to invite you to join the next session on January 13th, 2021. Again, from 12 to 1 p.m. Central, where our patient engagement team will discuss how to conduct a readiness assessment, both internally for your research team and externally for potential patient and public partners. You can find more info on our website, and we will also send the link to everyone registered for today's session, along with a link to the recording and slides, the resource list, and a brief evaluation so we can improve these in the future. Thank you, everyone. I'll let you go, and I hope everyone enjoys their day. Bye.